This is Radio Health Journal. I'm Reed Pence. This week, why so many local public health officials are quitting in the middle of a pandemic.
To be questioned, to be villainized, that for the majority of them is not what they signed up for.
Who's left to keep us safe when Radio Health Journal returns?
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
So construction has become ludicrous. We don't need as much space as we're building.
But what are we building towards? Then,
mostly it was my mental torture chamber. I have got to leave this. You know you've got to leave this, man.
What do you know about Scientology? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Most of the time, officials at the nation's more than 3,000 state and local public health departments do their jobs quietly. Some say if they're completely successful, you don't hear about them at all. But sometimes public health workers are controversial.
Keep in mind that public health officials have done things like enact smoking ban, sugar taxes or soda taxes. Those things do generate some controversy. So, it is a job that often has some controversy with it, and where often you find yourself doing things that other people disagree with. But we've really never seen anything as strong of a reaction as some of the things we're seeing now.
Dr. Marcus Plescia, Chief Medical Officer of the Association of State and Territorial Health Officials, says public health officials routinely issue orders to boil water or close restaurants for safety reasons. But measures to stop COVID-19 have generated pushback unlike anything ever before. However, Plescia says without a vaccine or medical treatment for COVID-19, there hasn't been a lot of choice.
We're having to go back to these core infection control type interventions, and, some of them can be very disruptive for people in their lives. I mean, clearly having to do stay-at-home orders and more or less shut down the economy for a period of time has been really difficult for people who have lost their jobs or not been able to work. And so I think people are frustrated, and we understand that. Now there's this arising sense that the public health officials are doing these things because we don't care about the economy or it's not important to us. That's really not true. I think that one of the things we have to understand is with the COVID pandemic and the economy, it's not either or. I mean, if we don't control this infectious disease outbreak at least somewhat, it's going to affect our economy because lots of people will get sick. They won't be able to go to work. People will be scared to go to shops and retail outlets. So there's a balance there, and I think we're trying to find the balance.
Public health officials who have always been so trusted in their communities are now having their advice either ignored or politicized. In the past, if your public health authority told you to boil your water because there was some contaminant in it, there's no doubt you would do it to prevent yourself from getting sick.
Lori Freeman is CEO of the National Association of County and City Health Officials.
And the same holds true for COVID. Public health officials are trying to keep you safe by asking you to wear your mask, to distance yourself from others, to wash your hands. But now this advice is being seen as some attempt to diminish your rights, that they're trying to keep you from wearing whatever you want or going out in the public or seeing whomever you want. Public health departments are even facing lawsuits over some of their authorities to close businesses, schools, places of worship in order to protect the community. And this is the very action that is credited with saving hundreds of thousands of lives from the virus. But some state legislatures are looking to limit public health authority to keep us safe when the virus spikes, and this all just adds up to an enormous amount of public and personal pressure on these health officials.
For public health officials, the protests are frustrating. It's like, I'm trying to do a good job keeping people safe, and this is the thanks I get? Plescia says polls show 70 to 90% of people agree with public health measures, but those who don't can make life miserable.
I think there's a relatively small but very vocal minority of people who, really don't think this is the right way forward, and that's getting a lot of attention right now. That's important because I think it's making it difficult for our health officials to do their jobs. And, frankly, we're asking a lot of people when they have to tolerate having folks come and demonstrate outside their homes and, do things that may feel threatening to themselves and their families.
A demonstration is one thing. The threat of violence, or even violence itself, is something else. Teresa Anselmo, executive director of the Colorado Association of Local Public Health Officials, says some public health workers have been attacked for shutting things down or refusing to reopen quickly.
They tell us that they receive threats either via email or on the phone. They can range in threats to physical harm or harm to property. A number of folks in some of our rural areas have had vandalism of their vehicles. In Tri-County Health, which is one of the most famous cases, we've seen in the news that they had their buildings vandalized on numerous occasions where windows were broken, while staff have been in those buildings working in the public health arena. We also see a number of very cruel base kinds of comments about the public health directors overstepping their authority.
Anselmo says even boards of public health, who usually hire the director, may not have their back. Some have been threatened with firing or unfunding, apparently because they won't go along with opening things up quickly.
It really, truly breaks my heart. And I have heard a number of our directors say how surreal it is. Not only do they not have the trust or the backing of their governments, they also don't have the trust or the backing of their residents. They are civil servants, right? They are ultimately, in the agencies that they work in, are part of a county structure, a county governance structure, and to not have the trust or the credibility of the citizenry that you are in place to help is very distressing to them. And it is very distressing to me to see them having to deal with the pressure and the types of attacks that they are getting. It's just heart-wrenching because they stay in those positions so that there's at least some voice of reason, even though it may be better for them to leave.
And leaving is exactly what some of them are doing. Over the last couple of months, more than 24 public health directors around the country have quit, a rate far higher than what you'd expect.
A number of the public health officials that are leaving are really just feeling the pressure of being in such a public eye, trying to do what they are hired to do, which is to advise and protect their communities about public health issues. And the political nature of this pandemic has created a lot of tension that they probably didn't sign up for when they took their role as public health director. At their hearts, even though the majority of them are not necessarily from a clinical healthcare background, they really are interested in improving and protecting their community's health. So to be questioned, to be villainized, and to have to deal with all of the political pressure that they're facing, that for the majority of them is not what they signed up for.
Freeman says just when they need public health expertise the most in the middle of a pandemic, local governments are closing their ears to it and sending it out the door. Anselmo says it may be very hard to fill those vacant jobs with qualified people. Who needs that kind of abuse?
There is a tremendous brain drain or a loss of institutional knowledge. We do not have a tremendously deep pool of people ready to step into these leadership positions. It's hard enough to find public health workforce, particularly in our rural and frontier counties, as it is. There aren't hundreds of public health workforce waiting to fill a void. And it's already hard for them to hire people. It's hard for them to hire people for the same reason it's hard for a lot of industries to hire people. The cost of living is high wherever they are, and the salaries that they can offer are low, or they're competing against other industry and other sectors that have higher salaries where people can actually make a living wage. And so it creates a tremendous void that I'm not sure we're certainly not prepared to fill, and I'm not sure how long it will take us to fill them.
Particularly the people in the leadership positions in state public health departments saying there are a lot of other jobs they can do. There are jobs that they can do that would probably remunerate them much better. You know, a lot of them are physicians. Physicians are highly employable. But, they're doing this because they want to, and they feel they can make a difference, and it's something they want to do with their career. So there's a real desire to do these kinds of jobs, but we're just concerned that this kind of reaction, this kind of backlash could begin to change that.
The irony is that many of these public health officials were undermined by the very success of their efforts to keep the coronavirus from getting a toehold. In states where infections were initially low, Anselmo says they didn't get enough credit.
If we're doing our jobs, you don't know about it. You don't see the problems because we have helped them avoid those problems. And so we're vindicated in the sense that, yes, we don't see those same things happening, but it also gives that false sense of security and that lowering of the perceived risk for individuals that they think, well, it was all fake. It wasn't true. See, we told you this wasn't as bad as it was going to be, but they don't see the ducks paddling furiously trying to make sure that that stays the case because we're doing our jobs.
But now, in many of those states, COVID rates have skyrocketed, and Freeman says it's become clear that it was premature to dismiss the need for continued stay-at-home orders, social distancing, and face masks.
We were hoping and praying that this reverse would not occur where we overcame, we reached a plateau, and now we're sort of back on the uprise. And unfortunately, when you start ignoring the advice of our public health officials, then that risk increases that we're going to continue to spread this disease, and it will spread as rapidly as it did before unless and until we take those tactics and measures, which are so very simple to actually put in place to stop it again. So we don't want to keep going through these rebounds. We want to get to a place where we've just eradicated this disease entirely. We all want to get back to work. We all want to get back to our normal routines.
Unfortunately, it's wishful thinking that the pandemic will just go away. It appears that the public health experts have mostly been right. We have to address the virus first, or nothing else will matter.
You cannot have a thriving economy if you don't have a healthy community, period. If you don't have a workforce that is healthy enough to go to work and to be productive, then it doesn't matter that you want to open everything up. If you don't have the workforce or the consumer to partake in that economy, you will have defeated the purpose of opening everything up. So we often say, if your goal is to get kids back in school in the fall so parents have the ability to return to work and not work from home, we have to do these things. They are a necessary step in making sure that we can achieve that ultimate goal.
You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
With everybody centered at home these days, maintaining one's health and a healthy outlook are critical. When each day delivers a certain sameness, snacking can become a comforting diversion. That makes healthy choices all the more important. Registered dietitian Courtney Romano is the health advisor for the California Table Grape Commission.
When it comes to snacking, fresh grapes are always a great choice. They are healthy and hydrating with a juicy pop of flavor and always ripe and ready to eat when you buy them. A smart alternative to processed snacks that come with added salt, fat, and sugar. Try freezing grapes for an all-natural frozen treat. They're like mini sorbets.
Grapes from California are in season now. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which research suggests contribute to a healthy heart. Visit grapesfromcalifornia.com for more summer cool ideas.
This is sponsored by Daiichi Sankyo Inc. There may be as many as 7,000 rare diseases, with as many as 25 to 30 million Americans living with a rare condition. Despite medical progress, many go undiagnosed, and most have no cure with limited treatment options. One rare disease that has historically had no non-surgical treatment options is tenosynovial giant cell tumor, or TGCT, also known as pigmented volungular synovitis, or giant cell tumor of the tendon sheath. TGCT is a rare, typically non-malignant tumor that affects small and large joints. The disease can reduce range of motion, cause debilitating symptoms, and be locally aggressive. Turalio pexidartinib is the first and only treatment approved by the U.S. Food and Drug Administration for adult patients with symptomatic TGCT associated with severe morbidity or functional limitations and not amenable to improvement with surgery. Turalio can cause serious side effects, including serious liver problems, which may be severe and can lead to death. Turalio can cause harm to an unborn baby when administered to a pregnant woman. The most common side effects of Turalio include changes in blood liver tests, hair color changes, tiredness, increased cholesterol level in the blood, decreased white blood cells and red blood cells, swelling in and around your eyes, rash, and loss of taste or changes in the way things taste. Because of the risk of serious liver problems, Turalio is available only through a restricted program called the Turalio REMS program. Howard Ruttman, MD, Vice President Medical Affairs, Daiichi Sankyo Inc., commented,
"As TGCT is a rare disease, it's important that patients speak with their doctors about their symptoms to find a treatment plan that is right for them. Turalio may be an option for adult patients with symptomatic TGCT associated with severe morbidity or functional limitations and not amenable to improvement with surgery."
Visit Turalio.com for additional important safety information and full prescribing information, including boxed warning and medication guide.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
I spend a lot of extra time trying to help patients understand what ECT is not.
What they see in the movies is not at all what happens in real life.
The misconceptions of electroconvulsive therapy, the ones about painful convulsions, broken bones, and no anesthesia.
Then lung transplants, risky procedures with a long waiting list.
Because of this constant exposure to the ambient air, lung transplant patients are more subject to acquiring infections and possibly rejection episodes.
All that and more on Radio Health Journal.